Understanding the differences between panic attacks and anxiety attacks. Panic attacks and anxiety attacks are commonly used terms that refer to intense periods of overwhelming fear and distress. While they share similarities, they are distinct in their symptoms, triggers, and duration. Understanding the differences between panic attacks and anxiety attacks is crucial in providing appropriate support and treatment to individuals experiencing these episodes. First and foremost, it is important to note that both panic attacks and anxiety attacks are manifestations of anxiety disorders, which are among the most common mental health disorders worldwide. However, the key distinction lies in the nature and intensity of the symptoms experienced during these episodes. Panic attacks are characterized by sudden and intense periods of fear or discomfort that reach a peak within minutes and typically last for a relatively short duration. Individuals experiencing panic attacks often report physical symptoms such as heart palpitations, sweating, trembling, shortness of breath, and a sense of impending doom or loss of control. The onset of a panic attack is often unexpected and may be triggered by specific situations or stimuli, while in other cases, it can occur without any apparent trigger. On the other hand, anxiety attacks, also known as generalized anxiety attacks, are marked by persistent and excessive worry or anxiety about various aspects of life, such as work, relationships, or health. Unlike panic attacks, anxiety attacks are characterized by a more prolonged duration of symptoms, which can persist for days, weeks, or even months. Individuals with anxiety attacks may experience a range of emotional, cognitive, and physical symptoms, including restlessness, irritability, trouble concentrating, muscle tension, and difficulty sleeping. Furthermore, the triggers for panic attacks and anxiety attacks differ. Panic attacks are often associated with specific phobias or triggers, such as enclosed spaces, large crowds, or traumatic events. In contrast, anxiety attacks are more generalized and may be triggered by a combination of stressors, worries, or uncertainties in various areas of life. In terms of treatment, both panic attacks and anxiety attacks can be effectively managed through psychotherapy, medication, lifestyle changes, and relaxation techniques. Cognitive behavioral therapy, CBT, as a common approach used to help individuals identify and challenge negative thought patterns and behaviors associated with anxiety disorders. Medications, such as antidepressants or anti-anxiety drugs, may also be prescribed to alleviate symptoms and regulate brain chemistry. One of the key strategies for managing panic attacks and anxiety attacks is deep breathing. Deep breathing exercises can help calm the body's physiological response to stress, reducing feelings of panic and anxiety. Techniques such as diaphragmatic breathing, where you breathe deeply into your abdomen rather than shallowly into your chest, can help regulate your heart rate and bring a sense of calm. It is important to practice deep breathing regularly so you can easily implement this technique when faced with an anxiety-inducing situation. Another effective coping technique is mindfulness meditation. Mindfulness involves being fully present in the moment, without judgment or attachment to thoughts and feelings. By cultivating mindfulness through meditation practices, individuals can learn to observe their thoughts and emotions without becoming overwhelmed by them. This can help break the cycle of catastrophic thinking that often accompanies panic attacks and anxiety attacks, allowing individuals to respond to their symptoms with greater clarity and composure. Regular physical activity can help reduce stress, improve mood, and increase resilience to future episodes of anxiety. Physical exercise is also a valuable coping technique for managing panic and anxiety attacks. Whether going for a walk, practicing yoga, or engaging in high-intensity workouts, finding a form of exercise you enjoy can be instrumental in managing your symptoms and promoting overall well-being. While panic attacks and anxiety attacks are both manifestations of anxiety disorders, they exhibit distinct characteristics in terms of symptoms, triggers, and duration. By understanding these differences, individuals can better recognize and seek appropriate support for managing their symptoms. Promoting awareness and destigmatizing mental health issues surrounding anxiety disorders is essential in fostering a supportive and empathetic society for those struggling with such conditions.